I decided to do my academic case study on a Jehovah's Witness with severe anemia. In this case, the patient is an 18-year-old girl who has sickle cell anemia. The patient is known as TH. TH is a Jehovah's Witness who believes that it is against the Bible and God's will to receive any blood in any form. Blood is acceptable only when used to shed for sins and may not be ingested or transfused in any form. A Jehovah's Witness who accepts a blood transfusion essentially dissociates themselves from the religion and is shunned by other members. TH was admitted for pain in her lower back with the onset of her menstrual period. She has been admitted into the hospital many times throughout her life because of her illness. This time is different, though. Now she is 18 and is legally allowed to refuse treatment against her parents' and doctors' wishes. Many of the clinical staff have treated TH since infancy because of her condition. Now that she is legally able to refuse medical treatment, this may be a hard decision to accept. Because of her sickle cell anemia, she is critically ill and her heart will soon fail without a blood transfusion. The only steps the doctors can take are to closely monitor her and give her fluids and something to help ease her pain. There are some things that may be able to help TH's condition, but not cure it, since she will not be able to take the blood transfusion. It is also important to determine if the patient is psychologically and physically capable of making decisions. For TH, her newly empowered status as a legal adult and the confrontation with a difficult and potentially life-altering decision. This can be overwhelming, but the care team should ensure that her decisions are not made under pressure from family or friends. It is also important for TH to get the support she may need from counselors and social workers as she must face this important decision. Pediatric providers seldom face situations in which their decisions to save a life are questioned or not accepted. When the patient is a minor, they can usually seek and obtain a court order for the treatment. When the patient is a young adult, everything changes. Pediatricians then feel anger and helplessness. Their personal beliefs and their lifelong training direct them to provide treatment, but they also cannot go against patients' wishes. This can be hard on the physicians as well. They are obligated to let TH decide her fate, even if their education and medical background is telling them they need to save her life. In the article, we get a response from Winnie Morrison. In this response, we are told that it is legal for adults to refuse medical treatment, even when it is life or death situations. This applies to Jehovah's Witnesses. In pediatrics, it is common to give blood transfusion to patients with Jehovah's Witness parents. It is mentioned in the text that 16-year-olds have a more informed opinion and are more respected with their decisions than 12-year-olds. The clinical ethics consultant in this case would want to explore how strenuous TH's objections have been in the past, what her relationship with her religious community is like, and how well she understands the consequences of her refusal. TH should also be offered the transfusion without the hospital staff revealing it to her family or her community. Some authors claim that in cases of Jehovah's Witnesses, patients accept transfusions if they will accept a transfusion if they don't have to agree to it. When contemplating cases like this, it would help if there was a plan before the patient gets 18 or severely ill. This would make the decision of TH and her physician a lot easier. They would both feel more comfortable and accepting whether TH and comfortable with accepting whatever TH and her patients decide. The risks and benefits of a transfusion were explained to TH and her family. The risk of cardiac failure and brain damage. Because she had been previously admitted and treated without a parent's consent, they had to have a meeting on ethics. The social worker, child psychologist, risk management, and the ethics team need to determine if her refusal is valid. The medical team also talked to TH and her parents about the different risks. The medical team determined she was capable of making her own choices. In the end, TH understood the risk, but she still refused the blood transfusion. TH was monitored closely throughout her stay and monitored on her hemoglobin levels. On day 17, she was sent home. There was a response from John D. Lantos, and he believes that pediatricians must get better at preparing the patients for a transition from childhood to adolescence to then adulthood. In this case, the patients were not adherent to the best medication to prevent her life-threatening anemia. She also had not had conversations with her about her new responsibilities to make decisions for herself. Lantos also states that physicians need to prepare for this experience like this. He states this: adults make bad decisions sometimes, and sometimes it is a life or death situation. In conclusion, TH was in a life-threatening situation where she needed a blood transfusion. A blood transfusion would have been standard care, but with TH being a Jehovah's Witness, it was against her beliefs. In the end, she did not receive a transfusion, but she did not die.